Hi, I'm Joyce Tumaki, your student nurse for today. So now I'm going to do a male genitalia assessment. But before we start, we should make sure to identify the patient by asking his name, age, and birth date. We should also ask for a permission because we're going to touch some parts of his body. And of course, we should provide the privacy and proper hand hygiene. So for the equipments we needed is of course the gloves, since later on we're going to palpate his male genitalia. So for the assessment of penis, I'll start with the inspection of the base of the penis and the pubic hair. And always remember that we need to take note the pubic hair growth pattern and exhaustion, erythema, or infestation at the base of the penis. So I'm going to inspect it. Okay. Next is we're going to inspect the shaft, which is here, right here. And we're going to see if there's any rashes, lesions, or lumps. And I'm going to inspect. And as I can see, there's no any abnormalities. Now we're going to do a palpation of the shaft, and it must be soft and flat and non-tender. So I'm going to palpate by using this. We must do it slowly because it can hurt the patient. Next that we're going to do is the inspection of the foreskin. We must observe the color, location, and integrity. Remember that the first skin must be intact or uniform color with the penis. So, as you can see, it's normal. Now we're going to inspect the glands, and you need to observe the size, shape, and if there's any lesion or any abnormalities. So, as I can see, it's kind of normal. And now I'm going to do a palpation for urethral discharge. We have to gently squeeze by using the index and thumb finger to see if there's any discharge. So as you can see, there's no any discharge. Now for the assessment of scrotum, we have to inspect the size, shape, and position of the scrotum. And we're going to look if there's any swelling, lumps, or bulge. And always remember that the scrotal sac is not usually symmetrical. It can be lower on the left side than the right side. So now I'm going to inspect, and as you can see, it is normal. Now we're going to inspect the scrotal skin. So we're going to observe the color, integrity, and if there's any lesion or rashes. And the next thing that we're going to do is the palpation of the scrotal contents. We're using again the index and thumb fingers, and we're going to look for the nodules, masses, and tenderness. So I'm going to put it. Okay. So next, for the assessment of inguinal area, we're going to inspect it, the inguinal area and the femoral area, and we were going to look for the bulge. Okay. So the next thing that we need to do is the palpating of the inguinal area and the femoral area, just like this. Okay? So now for the last assessment of anus and rectum, we're going to inspect the perineal area and the anal opening and look for its surrounding and see if there's any lumps, lesions, redness, rashes, and ulcers or fissures and thickening of epithelium. After that, we're going to inspect naman the sacrococcygeal area and look if there's any signs of swelling, redness, and dimpling of hair. So now we're going to palpate the anus. Of course, we must tell the patient that we're going to put our fingers inside of his anus. So we're going to palpate it just like this. We're going to insert our finger like that. And now we're going also to palpate the rectum, and we must also note for the abnormalities. Now we're also going to palpate the peritoneal cavity and observe the tenderness. And lastly, we will palpate the frosting and observe if it's non-tender or rubbery. And this is the end of our assessment of male genitalia. Hope you learned something and thank you for watching.